problems breathing.
Okay.
A lot of my problem areas on my right side.
Okay.
So it's been problems breathing. I did break my nose in 2014, and you can see a little bit. It used to be darker, but like right here is a dark spot where the blood was pooling. My eyes, it's not from not getting sleep, the darkness, it's actually from the blood that's pooled. Also, I know that breathing wise, I can't breathe through my right side. Like maybe
right nostril we were talking about?
Yeah, this one, my right
so
nostril.
The number one reason you're here is the septum or the breathing issue.
Yes, the breathing.
Okay.
Number two, I've been having on my eye area, I've been
right eye?
Right eye.
Okay.
Like, it's like a stabbing pain. It doesn't hurt, it just feels uncomfortable, almost like if I have a pencil right inside the iris, and it's just there.
When did that start?
It started to happen a year and a half ago.
What happened a year and a half ago?
Nothing. I just know that I got in a fight in 2014.
What do you mean you had a fight?
Yeah, I got in a fight.
What kind of fight?
Like a fist fight with a girl.
Okay.
Yeah, it wasn't that bad. It's just that's when she broke my nose on this side.
Okay.
And then I went to the doctor. The doctor that took x-rays, he just said it's a tiny bit, no big deal, it'll go back to normal. It never did. Within time, this part started to protrude inside.
Okay.
And it had a little dent. It's not there anymore. And that's where I'm telling you that there was a dark circle.
Got it.
And then I want to say about a year and a half ago, my eye, like it started to hurt inside the iris. And I started to, when it came to reading, I couldn't read. Like I would lose focus. I would stare at the words and I would find myself staring at the words. And I'm like, okay, what did I just read?
Lose focus mentally, not visually.
Not visual.
So
see,
you
it's
could
not
see
visual.
you
I
could
can
see the
it.
word visually. Yes. Your vision wasn't affected,
Right.
but you lose concentration.
Right. It doesn't register basically.
So you're not processing.
Yes.
Okay.
Not processing.
Okay.
So even when I read it again consciously, now that I say, okay, let me read this sentence again.
Yes.
I will focus on it and I will read it. But then in my head, I'm like, what did I just read? So I will redo it.
This has been going on how long?
For a year and a half.
Year and a half. And did something specific happen a year and a half ago?
No, it's just, that's when I noticed that all these chain of events started occurring. And then I started, within that same time, I started to get like a burning sensation.
Okay.
Like on my right side, like this whole right part. And it starts from here.
Okay.
And then it goes all the way down to like right here, and then it just burns like it's on fire.
Okay.
And then that's when I started to get really lethargic, really sleepy, really tired. And then what started to happen was, like, I'm saying there was fluid retention, because you could barely go like this and it would hurt so bad for like the whole day.
Was it boggy?
Yes, I would touch it and I would touch my left side, and it literally felt a little bit like there was water in there,
okay.
on my shoulder part. And we're talking about from my back to my shoulder down my what's that called? That little
scapula?
Yes, the scapula.
Okay.
So in between there, it was hurting really bad.
Okay.
At night, I would have to kind of sleep a little bit, sometimes with pillows on this side, just to keep it like comfortable.
Okay.
Because it would hurt. Like it was like a sharp pain.
And now?
Now, not too bad. Like after I went to Texas, it went away, but it's starting to have the same effect, I want to say, since October. It started to slowly, all of it started to slowly.
And we're in
come back.
April right now.
And we're in April.
Okay, we're in April right now.
Yes, and then the pain slowly goes down all the way to my lower back. All of it is on the right side.
Okay.
Down to my lower back,
okay.
And it just feels so tired, like on my whole right side. It just feels tired. I kind of tend to go like this because it feels tired, so kind of to take some of the weight off of what's hanging on the right side.
Okay.
But the water.
Do you sleep on your right side or
yes,
left
I
side?
do. I sleep on my right side because when I try to sleep on my left side, I've noticed that there's pressure on my nose.
Interesting.
So I have to force myself to sleep on the right side, so it could it could relieve pressure and my nostril could open up and I could breathe from my right side.
Understood.
So even though it hurts, I kind of have to figure out a way, put pillows or a
Pillow
blanket.
between your knees also?
No. I don't need that. I do end up sleeping, when I sleep on this side, no pillow, but I kind of end up sleeping where this part is hitting the bed. So
Okay.
I'm kind of like twisted like this. Number 3, so my
Okay.
right hand, I was in a not so good relationship,
Okay.
and my hand got busted because he took one finger here and one finger here, and then he opened it.
That's not right now, right?
No, this is back in
Okay.
2007.
All right.
So I literally felt, I got x-rays, the doctor told me that my bones were okay, that everything was fine. It was just my ligaments that were a little bit torn. It didn't feel like that because every time that I shook somebody's hand, and if they squeezed a little bit hard, I could literally feel this bone and this bone and this bone like literally touch each other.
Okay.
So up to the point where I would like cry, and I would tell the person like, please don't squeeze so hard, because it hurt, like it would hurt. And then what started to happen in school, my hand would cramp up when I would take notes in class, like going like this, it would cramp up and it would hurt really bad that I would kind of have to go like this to help it like uncramp.
Only that hand or both hands?
No, it's only my right
How
hand.
about the right foot? Would the right foot cramp up as well?
No, what I noticed that I do with my right foot, especially when my back is hurting, I tend to go like this. So I'll stand like this and then I'll wiggle it like this.
And
when
then it
my
feels
back-
better in your back.
Yeah. And then when I go like this,
Keep going. I'm just pointing
I go-
out. She just gave part of the answer to her issue.
yeah. So I go
Okay.
like this and I feel much better, but then it does feel a little bit stressed from doing that. And then I'll try to go like this and force myself to stay like straight like that.
Okay.
But then I begin to get the pain a little bit above, I want to say like on my belly button area, but on my back.
Got it.
And then I have to do it like this again. I've noticed that my shoes, I do tend to kind of eat them up like this.
You walk on the outside.
Yeah, on the outside of
both,
my-
And you've been doing that for a while.
Oh yeah,
right?
I have.
And
I've been
that's
doing that for a
another
while.
piece of the puzzle. So she just gave us 2 pieces of the puzzle. One, and I'm going to explain it when we get to the x-ray. One thing you talked about is walking on the outside heels.
Right.
There's a finding we were taught neurologically with that. Number 2, you're telling me though on the right side, when you supinate your foot
Right.
several times, it starts to relieve the back.
Right.
And we're going to go over the x-rays to explain why that's happening. Okay? All right. Okay, what else?
Well, the other thing that I've noticed is when I talk to someone, because it's happening right now as I'm talking to you and you're having me recall, it starts to burn like on this part. Like when I'm having to recall something and
Okay.
explain something or try to remember something, it starts to burn like not on the outside, but more like in the brain. Like if it's trying to make those connections, that's where it starts to burn.
Okay.
I know that about a year and a half ago, when all my symptoms started to happen, on my right ear, I started to have like swimmer's ear. It felt like that. I had no infection, no nothing, but it just felt like there was a lot of water. Like I had swimmer's ear and I would go like this to get it out. There was nothing there. It just felt really warm and like I had swimmer's ear. My dentist also has been having difficulty with my right side, with my teeth unlocking and being straight like how they're supposed to be.
All right, so we have jaw, nose, shoulder, all right-sided,
Yes,
and right hip, right low back.
yes. And every now and then I know that when I'll go like this, this
Yes.
part tends to crack a lot.
Okay.
But when it was hurting and the times that it was hurting really bad, we're talking about from here running all the way down, and it feels like my shoulder is dropped. It feels like every single day I'm just carrying something so heavy, and I sometimes feel like when I talk to people, like if I'm talking to them like this,
Okay.
and then yeah, so it feels like that to me.
So why are you here? Weird question, I know.
Why am I here? It started off with my nose because I saw your video, but then
Okay.
as I started to look into you and you sent me to get x-rays, I was like, okay, I know I have more than just the nose problem. I know I
Okay.
have a back problem just because it's been hurting.
Okay.
And I feel, in my opinion, like that's all connected to me not being able to remember things or recall things because it's all happening at once.
You're telling me all right-sided.
Right.
Could be cord pressure up top, upper cervical. Could be the hip that's out of balance that's causing all of it. All right, so first thing we're looking at is overall presentation of the spine. Where are the dimples? Dimples are here. Right side is a little bit lower than the left, okay? When we look here, right shoulder is a little bit higher than the left. Little more pronounced here. Right ear is higher on that side. Let's follow down here now, please. You can see the glutes. I'm gonna just cover it this way, so can you hold that?
Yeah.
I am gonna be placing my fingers here, okay? So you can see right side is actually higher, left side is lower. Right side is flatter, this is more pronounced. This is a potential AS, up and internally rotated hip, okay? That's just from what I see there. Wanna watch her walk. Go ahead and walk straight all the way to the table. Turn around, please. And keep walking. You're going to do this several times, okay? Slow it down. Swing your arms, please. Good. Good.
And I do have false steps.
You have what steps?
Like false steps. Like I notice that I tend to go like that when I walk.
Yeah.
And then I bump into the walls.
From there, walk straight.
Okay.
Good. Yeah, so you can see she wants to twist now as she's
Yes.
walking. Keep going, please. She's going this way,
Yes.
part of her, and the other part wants to come this way.
Yes.
There's a disconnect.
Yes.
March in place. Okay, I'm gonna just place my hand behind you here.
Okay.
Up there, you're not gonna fall. I want you to close your eyes and keep marching
Okay.
and watch what happens. As she does that, she's completely away from me now. Open your eyes, look at you. Come back and do this again. Watch. Close your eyes. And she's off. Dun, 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 dun. Okay. Stop. You see what's happening? Open your eyes. This is a foundation issue. This is a foundation issue, and this is a balance issue.
Okay.
So as soon as you close your eyes, what happens? It's upper cervical. When the eyes are open, you're walking, everything's doing good. As soon as you close your eyes, you start activating the cerebellum, the upper cervical mechanism. As soon as you do that, you're just going like this.
Yeah.
Okay? This is a picture in time. It tells me how you've developed, how you've evolved from birth. Yeah?
Okay.
There are 24 bones in the spine, 23 discs in between. This is the foundation of the spine, right? Think of this as a 24-story building, and the foundation, which is the sacrum and the pelvis. Yep.
Mm-hmm.
This is looking at you from the side. This is the side profile we're designed to have, 60-degree reciprocating curves. Looking at your foundation, your sacrum, and your pelvis.
Mm-hmm.
First thing we want to talk about are the numbers, what they mean, right?
Okay.
The pelvis works like this. One side goes up, the other side goes down. One side goes in, the other side goes out. I labeled AS2IN6 on the right, P3R, and a measured difference of 5 and an actual difference of 8.2. And this is really important for you to understand because this is part of the fix. Your right pelvis goes up,
Okay.
so your left one is slightly down. Your right pelvis turns in, so you're favoring to the right side. You also have a leg length inequality on the right side, 5 millimeters. Now here's the catch. You have a rotated sacrum on the side of an ASIN ilium, on the side of a misaligned ilium. In this work, Gonstead Chapters, page 43, tells us which to adjust first. According to the book, it says this. If you have an ASIN with a rotated sacrum, do the sacrum. Now, if we go for the ilium, let's think about it and put it together. ASIN, there's already a short leg here. Gonstead also came up with this ratio, 5-2 ratio. Every 5 millimeters of misalignment up, femur head goes up 2. Every 5 millimeters down, femur head goes down 2. In your case, if I adjust this to fix this right now, it's going to make this worse because it's going to bring it down. So what does that tell us? That's not the fix. We have to find it here first in the sacrum. Yes?
Yes.
Okay. Now I want you to see the tailbone.
Yes.
You can see a slightly bent tailbone.
Yes.
Okay? And then the 5 takes it off. Yes. You do see that?
Yes. And
Okay.
I do feel it.
Okay. So we have a rotated sacrum, ASIN ilium. Now let's go over the level foundation principle. Starting at the base, the level base, the first one to go off level is 5. 4 goes with it, 3 goes with it, 2 goes with it, 1 goes with it, 12. Let's do that one more time. 5 goes off, 4 goes with it, 3 goes with it, 2 goes with it, 1 still goes with it, 12, 11 comes back. Next one to go off is 10. 9 goes with it, 8 goes with it, 7, 6, 5, 4 comes back to level. 3, next one to go off is 2. And that takes your whole neck out. Do you see that?
Yes.
So you're telling me all this stuff here, right?
Yes.
The real question is it really, I labeled it here, is it this upper cervical potential, which we even saw in the exam? Or did it actually start here? Because look, that's kinking the whole neck.
Yes.
And then what is the atlas doing to compensate? It's doing this. Now part of what I do is I become the patient's x-ray.
Right.
Okay? So follow my process here, guys. Right goes up, leg is short, it's curving this way.
Right.
T10 is kinking like this.
Right.
T4 is kinking like this. T2 is kinking like this. C1 is like this. This doesn't feel very comfortable to me.
Right. That's exactly
Is
right.
this about you?
Yes.
Okay, you get it now, right?
Yes. And I do feel like that.
All right, so that's your AP X-ray here. Let's get to the top. We did in terms of the analysis, fine. An ASRA atlas on the right potential, a TMJ right when we're evaluating it on the X-ray. When you open the jaw, this is how it works, or this is how we evaluate. The last thing that happens when it opens, if it deviates to the left, right potential. It deviates to the right, left potential. But it can also go down, let's say on the right, and then compensate to bring the mouth back to neutral. This is thinner here, deviating away. This is thicker, the mandible.
Right.
So I labeled it as a right AI and a left EXTMJ potential.
Okay.
We're doing what's called a posture assessment. The ear should match the shoulder, the hip, the knee, the ankle.
Okay.
With this, I use the laser level, lowest lumbar body, do an X through it, use the laser level. It should bisect 7 and 2. And what this tells us is what? You carry your whole upper body behind your foundation. 7 and 2. We have old tailbone injuries. This should be a smooth arc. We have this one, the coccyx is off. We have a nub there, coccyx, yes. We have S4, S3, S2. We got to sort the sacrum out. Does that make sense?
Yes. It does.
Any questions on the x-rays only right now?
No, I know that as a child I did have a couple of falls that involved there, and even now, like with the whole bubble gut and all that stuff, that's where I feel it. I feel it here. Like I feel like it's not okay. I feel like there's days that my stomach is fine and it feels fine.
Okay, but you understand this?
Yes.
Okay.
Yes.
Have a seat over here. One thing I wanted to notice is she does have swelling in her legs. I want you to see this.
Oh, my ankles?
This is not how she's supposed to be.
I thought it was.
She has a lot of swelling here, okay?
Yeah.
There's a lot of edema. Starting at the base of the neck, first thing I'm getting is about 10 points, C6, C7. And then it looks like it's going to the left, and then guess what happens, guys? Goes to the right, ASR. So here's an interesting thing. It looks, we do have that reading down here, C6, C7. Actually down a little, even T1. So base of the neck and upper cervical. And the next thing we're getting is around T6, T7, 15 points, left side. Interesting. And as we go down into the tailbone, I'm just bringing this down a little bit. Right down, S3, S4, lady. Right there. So I'm getting here at the base, T6, base of the neck, and around C1, okay? Can I have you scoot forward, please? No more fights, right?
No. I never looked for them. They just happen.
I'm just giving you a hard time. You know I'm just giving you a hard time.
Yeah.
Okay. Right side feels higher, left side feels lower. Feet together. Are your feet touching the ground?
Yes.
Okay. Feet touching. Open and close your knees, please. Open, close. Open. Can you open a little wider, please? Close. Open and close. Open and close. Left side only. Right side only. Not too bad. Okay, L5, S1, S2, right there. Do you feel that one?
Yes, it hurts.
That's S3, S2 not as bad, but a little tender, yes?
Yes.
S1, tender,
Yes.
but starting where?
Right there.
S3. Static palpation, running my fingers down the spine. As soon as we get to right about there, you can see the edema start to pool. Right there. Tender?
Yes.
More tender there.
Yes.
That one or that one?
Confusion.
That one?
That one.
7, 6, 7. 1, 2, 4, 5, 6, 7, 8, 9. Yeah, it is actually 10.
Right there.
7, 6, 5, 4, 3, 2.
Oh, right there.
That's 1, and that's T1. Down a little bit. Is it okay? I'm just going to keep it like that, if you don't mind. So we'll keep the mouth covered. And we just want to look at the nose, and I just want to feel. Because there's a couple things going on. There's this part of the bone here, right? This is the nasal bone. Now, I want to be clear. I'm not adjusting a nasal bone. Okay? What I'm doing is I'm going to the septum here. This last piece. Do you feel that, right? This side moves okay. This side don't move as well. Yes? So we got a little bit of that high side of the rainbow on this left side that we need to open up. Yes? Okay. So that's the one we're going to need to open up when we get there. Okay. Go ahead and sit up for me, please. And I do need to check the jaw now, okay? Now, you can go ahead and look up slowly. Let's take this off for a second. Hold that. Open all the way. Open. Slowly close. Slow. That's the one. Do you feel this one? Okay, slowly open. And close. It's very misleading. It is actually the left AI major. Right is a compensation and EX. You can put your mask on, please. Now, this is actually a test certification question in the Gonstead certification. When's the only time you adjust a compensation before a subluxation? TMJ. So the right has been compensating a long time with this right atlas. I'll probably wait on the jaw today. My process is going to be, let me just, please. My process is going to be sacrum, atlas, recheck everything. Septum will do today, okay? And we'll see if we have to do that mid-back.
Okay.
All right? Sound good?
Yes.
Okay, shall we?
Sure.
Showtime. Showtime. Let's do it.
I stand on this?
Face down, please.
How does that happen?
Step on the black platform,
Okay.
face down.
Oh, okay. Do I get on? No, right? I step on the black.
Just like that. As soon as it goes down, you'll slide up, okay?
Okay.
So we're gonna do an ASRA, anterior superior right, anterior. And we wanna bring it back through. There. And that's a home run, lady. Perfect. Good. You okay there? 1, 2, 3. There we go. I got you. You good? Okay. You sure now? All right. Deep breathing. Oh yeah. Deep breathing. Oh yeah. There it is. Now we have a slight little drop leg on the right, we said, so we need to torque a little bit counterclockwise. Okay? Just to get a little lift. There it is. Gotcha. A little bit more. That's it, lady. Good. Give it a second. All I need you to do is hold the wrist. There we go. Let it roll forward, please. There. You're guarding a little bit. There we go. That's not good. Come on up. Walk it off, please. Let's see what happened from just that, though.
You want me to walk straight to you?
Straight line, please. Just keep going. Turn around, keep walking. Anything different right now?
Yeah, sort of. I feel like this leg is now more this way. Like, it's not wobbly. Because in the beginning it would wobble.
Okay. Let's go more on the knee chest table. I got a piece, I didn't get all of it.
Okay.
Slide down, please. Tummy all the way down. There. Knees apart. Tummy down. Good. There you go. Tummy down, please. All the way down. All the way down. There you go. Alrighty. Right knee back a little. Left knee in a little. That's your spot. Gotcha. Good stuff. Come up slowly. Just a tiny bit. Walk it off.
Alright.
Oh.
I just feel it all. I'm like, whoa.
Hold my hand, please. Let's walk. Turn. March in place. Knees in line. Okay, now let go for a second. Hand on the side. Close your eyes. You're not moving as much.
Right.
Check this out. Turn this way. March in place. Eyes open. Now close your eyes. Open your eyes. Okay. You feel the difference there? It's still moving, but it's a little different.
It's not as much.
C1 is clear. That cleared up the lower neck too. T1, T2 is clear. T10 is clear. Nice. Sacrum is, wait for it. Shasha. Clear. Now let's feel this way, please. Back towards me. Check it out. That's your L5, yes? S1. S2. Different? That's S3, lady. Different? Let me push harder. Different?
Yeah, it doesn't hurt.
Scoot forward, feet together. Open and close the knees. Make that should feel better. Right side only. Left side only. Yes? Right side. All right. Let's go on the gray table and do the nose.
On the back.
On your back, please. You ready? Okay. I know it. Tell me if you're okay breathing through your mouth when I'm doing this. Are you okay?
Yeah.
Okay, let's do it. Take the nose all the way over. There we go. Gotcha. Breathe. A little bit more, okay? Can you handle one more? Breathe. That's it. Gotcha. What's different to you?
Well, now I feel my left. Well, first of all, heel toe.
Okay.
That's what I actually do feel like I'm doing heel toe. Before it was mostly just the balls of my feet.
Walk, please.
Okay. My hip bone, it does feel more centered now.
Okay.
Before it felt like I was swooshing it too much.
How about the breath?
Well, this nostril right now, I'm breathing good, I feel like I'm getting enough oxygen, but this nostril feels like if it's plugged, it doesn't feel off. It just almost feels like if there was water that was there.
Yeah.
And it just plugged it.
Okay, come over here. Let's work on the ears, because the ears also help with the
Yes.
canal, semicircular canal, and the breathing. There you go. A little bit more. There. A little bit more. There you go. Deep breath in. Okay. Whatever's going to drain, let it drain now, okay?
Okay.
On your back, please. I need to work on your ankles.
Okay.
All right. Raise your right leg. And down. AS talus, medial tilt using the board so we don't disrupt the low back. Raise the leg. AS talus. Ooh. Stole my thunder. Okay. Stand up, please. Let's work on the hands. Squeeze. Squeeze. Okay. Humerus, radial head, distal radius, scaphoid lunate is where we need to start first. Humerus, there. Radial head from this side. Distal radius, posterior. Posterior lunate, posterior lateral scaphoid. A little more. There you go. Thumb, trapezium. Go like that 5 times. Squeeze my hand, please. Hard. Good. Squeeze. Good. Posterior ulna. Posterior lunate.
Oh, right there.
Yeah, posterior lateral scaphoid. Breathe in. Go like this 5 times, please. Squeeze hard. You feel that?
Mm-hmm.
Different?
Yes.
What's different?
But the middle finger, I know I'm touching you,
You don't feel it.
I don't feel it.
Tiny still bit here.
Yes. Oh, okay.
Home run.
That's what it needed.
Posterior lunate. Go like that 5 times. Squeeze with this hand first. Squeeze hard. Squeeze hard. Yes.
Yeah, because I had this was bulging out. It was starting to like bulge out more on this hand.
One last bit. Posterior distal ulna. There you go. All right. That's where we're going to start. Okay. Any questions with what I did?
No.
Welcome to the office.
Thank you.
You're welcome.